I understand this is going to be shown in Texas, so I'll mention I'm a graduate of Stephen F. Austin State University in Nacogdoches. Maybe that'll help buy me a little bit of street credit. I picture my practice as a prescribing psychologist to really be an extension of what I've been doing so far, but with a whole new toolkit involved. I've been in private practice now for 10 years. I work primarily in an office that is on the outer band of the Chicago suburbs and that brushes up against the rural counties to the west of here. By the nature of that, we have access to some psychiatric services, but they can be difficult at times to get quickly or to really integrate fully into what we're doing just because the specialists that work out here are so busy. So a lot of times we work with pediatricians and primary care doctors to get those needs met for patients. I look forward to really being a resource for the therapists that I work with. Being a psychotherapist myself, I'm very, very invested in the psychosocial intervention side of things, and I think that that's exciting to the clinicians that I work with. I look forward to having someone that's a deeper participant in that side of the equation and willing to really coordinate the medications more closely with what they're doing. But I also really look forward to the work I do with the primary care physicians in the area. I think I've been a resource to them thus far, but having the ability to prescribe really changes the dynamic a little bit in terms of them being confident that I have the knowledge to give really direct advice on what they're doing in their care of patients. The training sequence in Illinois, we complete the psychopharmacology masters, which I did at Nova Southeastern University in 2008. We have to pass the psychopharmacology examination for psychologists, the PEP exam. I did that 4 or 5 years ago. And a requirement that's unique to Illinois, we have a 14-month full-time placement at a hospital system comprised of 9 rotations. And I'm working my way through those right now at Loyola University Medical Center just outside of Chicago. And in terms of where I'm at in the training year, I've been doing this full-time since the beginning of 2018, and Loyola is very well set up for this type of training. They're integrated fully into a medical school, so they already had training rotations set up for the third year medical students that fit well with the goals of prescribing psychologists. So they loosely based my training year off of that clerkship. And I've so far done 8-week rotations in neurology, family medicine, and internal medicine. Internal medicine was split between time in oncology and the general medicine department. I did a 4-week rotation in emergency medicine and a 4-week rotation in inpatient pediatrics. And I, at the time of this recording, am 1 week into my 4-week rotation in geriatrics. And the plan is to have me go through 4 weeks of surgery next, followed by 4 weeks of obstetrics, and then I'll have 3 months of psychiatry remaining in the training year. And it's been a fantastic experience so far. I've gotten to participate in every level of patient care. I've probably, because the teams in the hospital rotate so frequently, I've probably gotten to work with somewhere around 60 or 70 physicians. So I've gotten a wide range of experience and perspectives, and so far have been met with just a tremendous amount of acceptance. Once I explain to everyone what I'm doing and what the requirements are, everyone's been rather excited to have me there and very willing to train me. So it's been a wonderful experience. I'll become a valuable resource to the therapists that work in the community that'll, I think, be very interested to have a prescriber that's doing psychotherapy as well, and that has spent the bulk of my career focused on that avenue of psychosocial intervention first. But also, I think I can have a really big impact with the relationships that I have with the physicians in the area, encouraging them to be more willing to take on the duties of prescribing for mental health conditions and being able to do evaluations and consults for them allows me probably to reach a broader number of patients than I could if I were just prescribing on my own without focusing on those collaborative relationships. In the group practice I work in, we really hope to develop a training program to support pre-docs and post-docs that want to pursue this as a means to get additional prescribers out into the county in which I work. So that's how I see this impacting the community I live in. Well, I've loved being a clinical psychologist so far. I think there's such a diverse range of activities that we can get involved in, and training that we can continue to pursue throughout our career. It's such a an engaging profession to be a part of, and this adds an entire new chapter to that. I can continue to pursue new skills as a psychotherapist and continue to learn more about medicine as I move my career forward. I think it just gives me such a wide range of things to continue to explore and pursue, but also just the satisfaction of being able to meet such an important need. This is throughout my career so far, the conversation around the deficit of prescribing services has always been a topic from day one of grad school through present day. And to be able to get involved with that and feel like I'm helping meet such an important need is a really satisfying part of my career.